McGraw-Hill Professional presents Zero Harm: How to Achieve Patient and Workforce Safety in Healthcare. Edited by Craig Clapper, Physical Engineer, Dr. James Merlino, and Carole Stockmeier. Narrated by Gary Macfadden. Foreword. Dr. Thomas H. Lee, Master of Science. During my childhood, my Chinese immigrant parents exposed me in countless ways to elements of Chinese philosophy. The central questions of this philosophy: what does it mean to be good? What can I do to become better? Were baked into the way my parents lived their lives and raised my brothers and me. More recently, I've come to realize that these are the very same questions we in healthcare ask all the time, or should ask. Zero harm is a powerful inquiry into what good is in healthcare, and how we and our organizations can achieve it. The book recognizes that the answers are complex, interesting, and challenging, that they involve far more than simply following a set of rules. Rules, protocols, and processes are, of course, vitally important in healthcare. Before performing a physical examination on a patient, the rule says you should always wash your hands. Before inserting a central line, you should check a patient's coagulation status. But on so many occasions, rules don't suffice. What rules should a clinician follow in deciding when to begin discussing end-of-life care preferences with a patient? What rules dictate to clinicians how to build trust and respect among other caregivers with whom they collaborate? It is in such vast gray zones that highly reliable healthcare organizations demonstrate that they possess more than just policies and procedures. They have philosophies and cultures. As the chapters in this book demonstrate, organizational philosophies and cultures bear on all aspects of performance, including safety, patient experience, technical excellence, and efficiency. Individuals and teams can't improve in these areas simply by following new and better rules. Rather, they need a basic set of values, norms, and behaviors in place that they can judiciously apply in the moment to address specific situations. When asked what it meant to be good, Confucius famously gave different answers in different contexts. In his view, people couldn't define goodness by mindlessly applying rules. Rather, goodness followed from learning behaviors and developing instincts that equip us to do the best we can in any situation, however unpredictable it might prove to be. Throughout my career in the United States, I've been amazed at how many of my colleagues have seemed to practice in accord with Confucius's teachings. They don't like it when organizations define excellence in rule-bound ways, and they are even ambivalent about guidelines. Certainly, they have a point. I don't know any quality measures that define the proper course of action in every situation. I can always cite a reason why a rule might harm some patient I have seen in the past, or might see in the future. Such concerns cause all of us to shift restlessly in our seats when we receive quality data suggesting room for improvement, and they provide us with an easy way to resist the imperative to improve. At the same time, we must improve. We all know that patients are injured as a result of our efforts to help them, and that they endure unnecessary suffering and fear. These challenges only increase as medical progress accelerates. More people have to work together to provide state-of-the-science care, and those people often maintain increasingly narrower perspectives. Opportunities for errors, intentional or not, proliferate. What would Confucius do? I actually think he would embrace the safety science approaches embedded in this book. The book's authors cover a variety of topics, but they share a common understanding of culture
Sample complete. Ready to continue?